Good morning, everybody. I'll just wait for the last few. So good morning, everybody. My name is Frances Dodd, and I'm head of the NHS Northwest Leadership Academy. It's an absolute pleasure to welcome you all here this morning to today's Power of Political Partnerships Masterclass. That is a tongue twister, and I have had to keep, and I've just said it is, but there's a lot of P's in there. So it's lovely, it's really lovely this morning to hear the buzz and everyone to be here. This event is organised by us, the Northwest Leadership Academy, and was originally identified as a need by our colleagues who requested to know more about the political landscape and also to appreciate the different political factors that are affecting our health and social care today. So a little bit about us first. We're very proud to be the Northwest Leadership Academy. We're proud to be unique and a bit different because we are a member-led organisation and we're serving over 40 trusts, ICBs and healthcare providers. And at the forefront of what we do is to build, nurture and enable collaboration across the health and care sector, and today is a perfect example of that. This is one of a series of masterclasses that we've developed for the NHS Northwest region, and it forms just part of our offer. We provide core and bespoke leadership development, we specialise in executive and board development, and also lots of coaching and mentoring. I would love to tell you lots, but I realise that's not why you're here today, but I had to get something in. So if you'd like to know more, please do come and talk to me, or I'm joined by lots of my colleagues. We're all wearing this green staff lanyard. So if you want, lots on the desk there and lots of people around on different tables. So please do stop one of us and come and have a conversation. Also, anything about today, again, please just come and ask us. I've got a few practical things as always. No fire alarms planned. If the fire alarm is activated, it's electric siren. You follow the green running man, obviously not to use the lifts. And then the assembly point is at the front where you came in, which is opposite, which is in the car park opposite. Filming, you'll see we're being filmed as we speak. There's Ross there and his team are here filming. What we want to do is capture some of these events. There's a few people, understandably, who couldn't make today, but they're really keen to know what's going on and to learn about the event. So we will be producing a highlight reel from today. There'll be nothing on your tables, so feel free to say exactly what you want on your tables. If you don't want to be filmed, please can you let one of us know? And obviously, totally appreciate that, and we'll make sure that you're not in any of the videos. So on to today. Never has the subject of political partnerships been more relevant as today. On a daily basis, we are reminded on the news just how important politics is and health and social care. It is at the forefront of most of the discussions and most of the news at the minute. So to ignore the political landscape would certainly be at our peril. However, on the other hand, it also identifies to me just how many opportunities there are for us to influence politics in our region. So all I ask is really make the most of today. You've got a day away from your day job. You've got a day away and a chance to think and reflect. And being a psychologist by background, I would say that actually that's the time that you really have a chance and a time to think. So just make the most of today. The other aspect is also have a chance to network. The room is full of some amazing senior leaders across the NHS and across local government, and please just take the time to get to know each other. We're also going to have some some former MPs come along as well, which will be really insightful. So that's all for me, and I want to just carry on by introducing Catherine Eden, and I'm delighted to welcome Catherine. Catherine is the Managing Director at Eden and Partners, and they specialise in helping senior leaders to better understand, to work with, and to influence the politics and politicians that affect that sector and the sector they work with. Catherine has put together today and has put together a fantastic agenda, which I know that you'll see on your table. And she's also invited a group of former MPs along this afternoon, which I certainly am really looking forward to. And they're going to use their experience to educate, to challenge and support us in what is our new intake of MPs and the very different way our region looks across the North East. So that's all from me, and I will now hand over to Catherine, who's going to run through today and get us started. So thank you very much.
Anyway, good morning everybody. As Frances kindly said, I'm Catherine Eden and I'm going to be really your ring mistress for today. But hopefully helping you and guiding you through what we hope will be a really interesting day. It's been lovely to see some familiar faces here because I have been knocking around the health and care world for some time and in the Northwest, and it's really lovely to be back. Just by way of introduction, I'm one of those sad people for whom politics is an interest and has become a career. I've worked in and around local government, Westminster, the European Parliament. I've worked for a health charity doing their campaigning and parliamentary work, and I have worked in the NHS as a manager. But for the past 14 years, I've been designing and running leadership programmes that predominantly bring together health and politics and help people working within the health and care sector sometimes make sense or wade through the murky world that is the politics, whether it's organisational, local or national. And I'm really lucky that politicians from all levels come and help us with the programmes that we run, and really pleased to have a group of them this afternoon. They are all individual specimens of politician, all different backgrounds, but hopefully in the conversations you'll have later, with a bit of context this morning, there'll be some things that you can really tease out with them, particularly with regard to the situations you're facing locally. So, as Frances said, you talked to the Academy about what you needed, your challenges, and many of you, and I know you're all working at very different levels of the NHS, from exec to non-exec to sub-board, board. So there's some great experience in the room, and hopefully you can all, that will be a good learning experience for everybody. But what you told us that you wanted is a bit of dedicated time to think about, the world has changed slightly since July. And just to think about what it means for you as NHS leaders and your interactions and how you get the best for your patients, your organisations and your staff locally, given the changing politics and the really very difficult circumstances in which everyone is working. So today is going to be very much you talking to each other, but also then with a bit of interaction with some colleagues. So I thought we could just start by sort of having a look at where you are in the Northwest. Anyone who's a Manchester and Manchester City Council person will be used to everything being very red with a hint of other colours. But since the election, I mean, there really has been a very significant change in your region. And you've got 4 cabinet members along with the Speaker. So, you really, really are a red zone now. And if you think it's always been quite red, well, actually, having a look at election results in the past, we sort of ignored 2017. It was one of those weird elections that just popped up and disappeared again. But so if you just have a look at where, what has happened in the Northwest, you can see that it really is a very significant shift at this last election. And I guess the question is, so, what does that mean? What does that mean in terms of the way you engage? I will also put my hand up and say that since the election, I've been working a couple of days a week with a new MP in a different part of the country. So some of my experiences of working in his team and engaging with the NHS, I can bring to bear today. Some have been very positive and others have been less so. And hopefully that will help with some thoughts. If you tend to sit in one of the blue or yellow parts of the country, the region, you're certainly in the minority at the moment. I thought it would be worth just having a look at that. So unusually, this Parliament is very full of newbies, a lot of new people. Even seats that stayed the same party changed MP. And what does that mean? Well, you've got a lot of people who are jockeying to get their faces known. They're wondering, will I sit on the back benches? Will I get spotted for ministerial office? Will I be sitting on a committee? What campaign am I going to lead that gets me recognition? Very few people entered Parliament this time wanting just to sit and do very little. They're all eager beavers, so there's been quite a lot of jockeying, particularly amongst newly elected Labour MPs. Obviously the demographics are interesting. And certainly I put on this sort of educational side of it because that is a huge shift in terms of the Cabinet and their experiences of education. So that's just maybe relevant, maybe not, but it's a fact. I was surprised that the average age hasn't dropped a bit more. Maybe it's because I'm getting older and MPs all look younger. Sadly, when the average age is younger than you, you know that probably is the case. But, you know, certainly there are some people some of you are in your children's age group, who have very different experiences and approaches to everything. So some of them may be your local MPs. So, you know, if you're shifting from someone who's been at the older age to a younger MP, it may be really significant in the way they want to engage with you as the NHS. So as I said, you know, many of these new MPs are eager to get things done. That's what they've been elected for. A lot of MPs are in seats with really small majorities. A lot will be assuming that they've got 5 years and that's it. So what are they going to do in their 5 years? And sometimes that breeds behaviours that might be a bit challenging. So hopefully during the course of today, we can have a think about how you might manage that to the best, you know, for the best outcomes for your organisations. I mean, certainly the NHS is going to be the biggest or one of the biggest issues for any MP. It always is. But certainly in times where the finances are tough, where difficult decisions are being made around commissioning, it's going to be difficult. And I think the alleged comments by Wes Street, I'll say alleged because I think they were a source at HSJ said, so I don't want to quote him directly, but, you know, Wes saying to NHS leaders, crack on with the things you've got to do and ignore politicians who don't like it. So Wes Streeting has told you to get on, do what you need to do, and local MPs will fall behind. And ministers will not support local MPs over NHS leaders who are making difficult decisions. And that will be interesting to see how that unfolds, is all I would say. But that is a very interesting shift. So if you're thinking of closing your hospital, walk-in centre, GP practice anytime soon. Anyway, but obviously MPs, if the communication is good, they can be brought in as fantastic allies in supporting you with service change. If they understand the case, they understand particularly the clinical case for things you're doing, and they do understand the money has got to play an issue. But communication, as we'll talk about, is really, really important. So what we wanted to do is just give you a little opportunity to start talking to each other. Now, we've got tables out. We've actually got, not a spare table is the wrong word, but you at the back, in the back table, the naughty corner, doesn't have a table number. This is only because we have 9 former MPs coming later, so we will have 9 tables for conversation. That table is not one of the 9. So you can either sit there for this first part, and then later you can disperse beautifully around the other ones, or if you'd like to move sooner rather than later, please do. I'm going to leave it up to you to decide. But anyway, for the rest of you, I'd like to give you a decent amount of time to have a conversation with each other. Your experiences locally, you know, what's changed, what feels different, and how are you working differently, either individually or collectively, as a result of that. I'll just give you one example from where I live, which, as I say, is in a very different part of the country, and our interactions as a new MP with the Integrated Care Board. For context, it's an area that was entirely blue and is now surprisingly red in parts, with the odd blue and bit of yellow. The ICB has continued to work the way they've always done. We have quarterly meetings on a Friday morning, and we invite you, and we will put an agenda up. Parliament has now been asked to sit on Fridays quite often, as well as Mondays. So we've had to cancel meeting after meeting, but yet this hasn't quite registered, that we're going to have to think about a new way of working because the way Parliament is working is different and when MPs can be available. So that's one thing. The sorts of issues that are being raised are very different, and the sorts of constituency issues that are coming up seem to be different, and that the MPs are wanting answers from the ICB on around commissioning decisions. But I'm not sure the ICB has quite got there yet in terms of thinking about that. One of the key rules of working with MPs is always no surprises. And it's always a joy to be greeted on a Monday by being told the end-of-life services are being decommissioned as of April, with nothing put in its place. And you haven't heard that from the ICB, you've heard it from Marie Curie and their supporters, who are large in number across the constituency. So there's been a few interesting learnings so far. Thinking about the communication. But certainly all of our NHS organisations have had to shift in terms of how they deal with a new group of MPs for whom the issues that they care about are different and they're expressed differently. So anyway, I just would love you to have a conversation with each other about what it feels like where you are. We've said we'll give you half an hour, but let's go till 10:15 on that. So over to you. Well, it's lovely to hear laughter as well. I don't know if it was the at politicians, with politicians, or just generally. Thinking, and just, I'd love to pull in some of the examples of things you've talked about, perhaps positive interactions, things that would be helpful to share. Or if you've got something that's quite funny and would like to share, I think that also is good. But certainly, would anyone like to give us a positive example of the way that you've been working, either previously or since the election? We've got some mics that are roving, and you can tell us what you think, what you're talking about. Any hands? No positive examples. Okay. Right, let's go for some less positive examples if we're going down the scale. Lovely, thank you. My colleague will give you a mic. If you'd like to just say where you're from, that would be really helpful, unless you want to remain anonymous.
I think we did have quite a lot of discussion about positive, but the importance of establishing positive relationships and trusting relationships with MPs. Within our patch, we have 2 new Labour MPs and 1 remaining Conservative MP. We reached out to them early on and spent quite some considerable time actually establishing that relationship and establishing a way of working and how they would like to be kept in touch with what's going on. We put it all on the table, the good news and the bad news, and some of the challenges that we literally said, you will be hearing this on the doorstep, and this is the situation in relation to that. Some things we can change, some things we can't change, but we're willing to have a discussion with you. And it's been very positive. I think it's also really getting to know them and their interests as well. But a comment I made sort of early on in terms of thinking of the title, The Power of Political Partnerships, is we touch quite a lot on the importance, while I recognise there are a number of MPs or ex-MPs coming in, the importance of local politics, particularly as we move towards devolution. And very often councillors can be there for 5, 10, 15, 20 years. Yeah. And the importance of establishing those relationships and recognising that they may have different outlook on life than MPs.
Yeah.
So that was sort of some of our discussion.
That's a great place to start, thank you. And today we are really focusing on the Westminster. However, 2 of the colleagues that are coming are sitting councillors. And it will be interesting if you're on the table with the conversations to them to get their reflections on how it is for them working with a new intake, but also their reflections of their time in Parliament. But absolutely agree, and with the whole move to different mayoralties and regional. There's a lot of change going on. It's that thing, isn't it? At one point the NHS is reorganising itself, and it feels like things are slightly stable at the moment, and now it's local government's turn to have a go. So for those of you in public health, you're on the move again. Thank you. Yeah.
So what I was going to say actually is more that, so I'm from the Integrated Care Board in Greater Manchester, Paul Lynch, and we were kind of talking at our table that it's not necessarily positive or negative, it's different in Greater Manchester and feels really different. So our reflection was that a lot of the engagement, the contact with the political system is through the mayor in Greater Manchester. And there's a few reasons for that, because of his previous role as health secretary. He's now chair of our Integrated Care Partnership Board, and just because of his kind of level of awareness of him in engagement in GM. So a lot of the contact, both in terms of nationally with national governments, is through the mayor's office. So it feels quite different. The risk that we talked about was actually, does that mean that MPs in GM feel less engaged and feel less connected to the agenda? So that was something that we were kind of keen to talk about what does the impact of that look like. So we've got the advantage potentially of national influence, but we need to make sure we're bringing local partners with us.
That's a really interesting point to pick up this afternoon with colleagues who'll come. Everyone likes to think they're top dog, I suppose, in a patch, and then it all gets a bit murky, doesn't it, if you've got other top dogs, but other places are doing it. But I think Manchester, you do have a very different situation from other places. You're special, you're ahead, you're everything. Thank you, Paul, though. Any other comments, reflections? Yeah, thank you. Are you able to pass that forward?
Keep the mic. Hi, I'm Dan, I'm North West Ambulance. So I guess I was having a slightly different conversation around the footprint that we cover and the challenges that presents. Because some of the discussion we had on the table was around kind of getting to know your two new MPs. Now, the reality is for us, that's just not something that we can do in detail and at scale. So certainly I think from my perspective, one of the challenges we have is, A, the visibility and engagement and getting that right and where that is and with who. It does sometimes feel that, probably with the nature of the service that we deliver as well, that often the engagement occurs post-incident, let's just say it that way. And some of that's often about then that reassurance and assurance process. So it is sometimes quite difficult to kind of engage in a positive sense politically, because very much we're often on the defence, not the offence in that respect. And I think we talk through, certainly from our perspective, one of the things I think we all see is that challenge that we've got at the moment of, back to your original point, which is, I'm from Lancashire, so it's a bit blunter. If you're going to get rid of stuff now, get it done now, and we'll give you a bit of air cover. Now, that sounds all good in reality, but it'll be really interesting to see how that plays through. And I think from us as an organisation, some of those changes will have an impact on our ability to deliver the service, but it's also how we stand with our partners from a system perspective. So that probably is kind of my reflections from a slightly different perspective.
Thank you, that's really helpful. I mean, I would just reflect, in the area I'm working in with the MP, we have had absolutely no contact whatsoever from the ambulance service, nothing. No, nothing. I mean, nothing in 7 months. So it's highly likely that our first contact is going to be because of a problem. So I would say building relationships by just at least saying what you do. Many MPs will assume you just do ambulances and they don't know about the other things you do. So informing, making sure that you've got clear lines of communication when there are problems and expectations, but just saying what you do. It's always that delicate balance of not wanting to tell people that they don't know much, but most MPs don't know much about the inner workings of the NHS, and certainly how commissioning works for many. You know, the whole thing is a bit of a mystery. So I would say, if you haven't done it as an organisation, just informing, being in touch with all of them, and I agree, it's difficult for you, but I think having some contact is really helpful. Thank you very much. Any other points or that anyone would like to raise? Deathly silence.
Can I just reflect?
Have the microphone from him.
No, it's not about working with the MPs. It's just, I'm sitting here thinking, well, improving health is inherently political. And the interaction with the political system has to be integral to our practice. And I was thinking, rather than positives and negatives, how can we use the political system as a means to an end? Yeah, I'll leave it there. Because it is important for us to consider, and there are lots of top dogs. Let's just not assume there's just one top dog and one hero here. And therefore, how do we influence each other, and how do we actually meaningfully interact with the political system in such a way that we can do what we're here to do?
Anyone wants to give a, yeah. Here. I mean, I would say you have got a huge opportunity here for 5 years in the North West with your mayor, with the numbers you've got and the sort of heft and spotlight that brings to the region. You do have an opportunity now that may not be quite the same for a while. So although I understand the context is very difficult financially and everything else. Thank you. Come on in.
Can I respond to that from a slightly different context?
Please do.
My day job is a lawyer, and I deal with major inquests and inquiries. And part of that work involves political lobbying to try and effect change. What has changed since the general election? I've noticed that ministers are more receptive, that people are actually listening, albeit with the reservation that it's very much Treasury-led at the moment. So suggest anything to us, but don't cost us any money.
Yeah.
The other thing I'd say for the NHS and looking down the years to come is that we have the COVID inquiry, which I'm involved in, which is ongoing, and will lead to recommendations about building more resilience into the system, inevitably. And that will include, has to include, more resilience within the NHS. I don't see any way they can avoid that. So that's something that over the next few years might support our ambition for a better funded, or at least better run, if I can say that in a room full of senior leaders, NHS. And the other thing I'd say, which we haven't mentioned, is looking at policy for the next general election. So the Labour has a policy committee, and one of the 5 items on the policy committee over the next 5 years is the NHS. So that gives it an opportunity to feed through MPs into the committee that is drafting policy, which will lead into the manifesto for the next election. And I think it's worth thinking about that as well, not just about things that are impacting us day to day.
You've made me feel really tired thinking about another election already. Thank you. But you're right. I mean, MPs are thinking about their legacy already. What am I going to do in the short time? What do I have the power to do? What can I shift a little bit? What can I bring to my area that shows there's a meaningful difference? And they are writing their election leaflets now. So, yeah, but manifesto planning is always important, but give us a bit more time. And anyone else like to come or answer Sakti's point there, or give a view? Just in that case, just bringing in sort of local government and the dynamics of how you're finding that, because that's a really interesting point that you brought in. I don't know, let's have 10 minutes and talk to each other about that interaction between local government and the MPs and anything that you've seen different. Certainly where you've got parties all of the same, interesting, sometimes helpful, sometimes not. Parties that are different, what's happening, what's changing. Maybe have 10 minutes just having a think about that interaction that with local government and the MPs as you see it, and then we can pick some of that up later with the colleagues. Okay, we're heading towards the break, but before we did, I just wanted to see if there was anything in the room that you'd like to share that you've been talking about, particularly the interaction with local government and your MPs. Or have you just gone on a local government mission? I'm giving you your last sharing opportunity before coffee. We are not a group of sharers. I will not keep asking you to share. No, any thoughts or any reflections that you'd like before we sort of close this bit off and go and have a coffee? Yeah. Hang on, let me give you my beautiful assistant. My glamorous assistant. There we go. Yeah, make it worth it.
Volunteers. Thank you. So we were just talking about the kind of, I guess, the tension it creates really in terms of the development of the Integrated Care Board has meant that we've got places that are very integrated now with their local authorities and really strong relationships with councillors and the team at the local authority. And it's really kind of meant that we don't necessarily need the same level of engagement with MPs. So we're just wondering about whether that's been more of our focus from a local sort of council, local place perspective has really been on building the relationships with the leads for social care, for mental health, LD, rather than thinking about the MPs. So that's perhaps a challenge that we've got.
Yeah, very interesting. And obviously boundaries are with MPs are going to be different and messy with that. Yeah, thank you. Anyone else want to pick up on that in the room of non-sharers? Right, we're going to put extra sugar and caffeine in the coffee, and it'll be like little Duracell bunnies afterwards. But thank you. This is just the start of the conversation. We'll keep going after the break, but do please go and have a break. But you've got half an hour, because it's really important that you are here very much today. It's about networking, and it's about meeting colleagues. So we'll be back at 15:15. You may feel like this is a game of musical chairs. And for the final round in the musical chairs, I just want to kind of lay out there that for the conversations with the former MPs later, you may find it helpful to sit with people in your system so you can have conversations about issues that are affecting your system. Now, if you are not already sitting with people and you would like to do that, we have an opportunity to move again. I know that makes everyone really uncomfortable. I just want to say that for the next little while, you're okay. But once we start thinking and planning about the conversations you want to have and tease out with them, it's entirely up to you, but you may want to use it as an opportunity for your system. Systems, plural. Okay, just also one other thing that I've been talking about in the break is I understand, and this is, you're amongst friends. At Chatham House, we're all here today, certainly. But I appreciate we're being filmed, so some of you may feel less comfortable in sharing than you in a big group than you might do on your table. So I do appreciate that. And I'm saying that's the reason why you were all non-sharers earlier. I just thought before we go into that, I just would take you a little bit into the mind of some of these new MPs particularly, and just throw out some things for discussion really that you might like to think about as leaders. So the first thing is thinking about your new MPs' interest priorities. You referenced it earlier, really getting a sense of what makes them tick. Their personal experiences, really, really important. You know, whether they grew up as a child in care, whether they have had a breast cancer experience. You know, all these things are really, really critical. They're heart issues, and they will really direct the amount of time and energy MPs give to a particular subject. They may have had previous professional experience that can be useful and sometimes also challenging. Certainly an MP I worked with was a previous NHS finance director, and she didn't want 3 bullet points on a side of A4. She wanted the full report. And you only know that because you ask the question. Reviewing what they campaigned on in the election and what they are saying in social media, in media. Having a look at which committees they might be a member of, which all-party parliamentary groups, the MPs after school clubs, they might be members of. There's a registry on the Parliament website of those, so you can get a sense of people, you know, do they have an interest in eye health particularly, or in adoption? You might get a sense of where they might spend more of their energy. Because particularly in this labour intake, there's so many of them, and you can't give everybody a job. There's a few new invented jobs that people have been given to make them feel important, I think. So there are some, and some relate to the region. You've got 2 MPs, Andy McNay and Kirith Entwistle from the North West, who are North West champions. So they are people who are kind of having more of a brief, looking at the region and representing those interests in Westminster. So those are 2 people worth having a look at. There are also what they call the mission champions. There are 5 missions in government, and each of them, they gave a backbencher a mission champion role, cape, everything. And certainly one of them, Sarah Smith in Hyndburn, is the mission champion for opportunity mission. Again, just worth knowing. It means that she's got more of an ear into Cabinet Office work on the mission stuff, and it may be helpful for leveraging things you're doing around apprenticeships, perhaps. But just worth knowing that she'll have more of a sort of pan-regional view. I mean, clearly you're going to monitor what they're saying in media and social media, because that's where they spend their time. But it's very much personal priorities as well as the ones that have been in the manifesto. And you'll all have digested the manifesto, I'm sure, intently, and know all the things that they are hoping to make some progress on. In terms of clear lines of communication, and you made a really good point, you made beautiful points, thank you, at the beginning. If you don't have a sort of modus operandi of working with your MPs, it's really helpful to have one. I mean, you want to be at the stage of having your MPs, they have a personal parliamentary address. It's something .private. You want that one, and you want their mobile number. You all know that surprises and MPs aren't a good combination, so they want to hear from you on a Sunday night if there's a problem. But that parliamentary private one is used only really, we would only give it out to leaders in key organisations we want to have that level of conversation with. And certainly knowing who the key staff member in their office is, they'll be able to tell you how they like to get their information, what doesn't work. They'll manage their diary likely, so they can keep you up to date with how the parliamentary timetable is changing. And as I say, we're having, like the assisted dying bill was on a Friday because it's a private member's bill. So that means all your constituency stuff on a Friday has got to go. But there's increasingly more of those bills coming through, which are likely to mean that plans you'd made beautifully for Fridays and Monday mornings are needing to be shifted. So just keep having someone in the office you can touch base with is very helpful. And yeah, I mean, the no surprises thing, as I said, this end of life thing we've had recently really was, it was a difficult surprise. You don't want to know all your end of life care services are finishing with nothing in place. That's a problem. In terms of casework, response expectations, obviously MPs working as advocates will have occasionally cases that need to come to you. I've been surprised how few we've actually had in the office compared to other things, housing, endless housing issues. Some constituencies will have lots of immigration, for example. But just knowing how many days you expect to come back to the MP with a response, because they want to be able to tell the constituents. So just having really clear what we expect we will do, and a really clear member of staff whether it's the chief exec's chief of staff or someone else, whoever it is, being really clear about those expectations. And that just avoids the communication problems and the MP looking like they're not doing their job well in front of the constituent when actually all they're doing is trying to get an answer to a health question. So they would really appreciate that. I mean, you might want to think about whether there's opportunities for getting maybe some of your PALS teams in to spend time with the MP's office. You know, are there just to, and swap over vice versa to get a sense of what's coming in from the public in both of your offices. You're both doing similar jobs. Might there be some shared learning there? Most MPs' offices would really value that, I'm sure. Political and personal dynamics, and particularly when you're trying to work with a group of MPs, particularly if they're the same party, it's the no assume rule. No, assume they talk to each other, like each other, have shared views, even if they're the same party, the same local authority area, and they're next door to each other. If they're married, maybe that's easier. I don't know whether we've got that many married couples this time, but we have in the past. But certainly, understanding each individual does take a lot of time. I appreciate it really takes time, but just not assuming that you can talk to one and you've talked to all would be strongly recommended. As I've said, there's this issue about constituency time. MPs want to be in their constituencies on Fridays. They really, really do. But as I say, the parliamentary timetable is making that more tricky. So just asking them the question, you know, what's the flexibility? They appreciate they won't be doing visits at weekends. But, you know, what is the flexibility? And most North West MPs won't be able to pop back during the week. But certainly making use of the recess times, which pretty much match to school holidays. Making as much use of you can as you can of them during the recess when they should be in the constituency. I mean, certainly MPs, most of them, particularly the younger ones, are massively into their comms and their social media, and will have someone in the office doing that. So what are the opportunities to use them as a bulletin board to amplify things that the NHS is doing locally? They don't just always, well, the MPs don't necessarily just want to always post about their faces and them doing things. They do also like to be seen to be a useful community bulletin board. So, you know, if your comms teams and their comms officer can work together, that can often be very helpful in communicating really important public health issues, particularly with constituents. So this is going to be interesting, and this sort of plays a bit to the Wes Streeting point about MPs falling in line with what the NHS decides locally. And many of you will have had past experiences where local MPs have been manning the barricades. There was a Hazel Blears issue, I remember, in some deep and distant past in Salford, where she was nationally in government supporting something, but locally was on the barricades with the bedsheet painted, Save Our Hospital. So most MPs, given the small majorities for many of them, are likely to adopt a constituency-first approach. But if that's going to come into conflict with what you're planning, your plans are for services, early conversations with the right people within your organisations is really, really critical. Because you've got to remember the MPs are hearing everything from their constituents. They're meeting groups of health professionals separately in different forums. They've got them in their local party. So just trying to prevent the MP being with the bedsheet on the barricades is what you're aiming for. It might be neutrality that you're aiming for as a best case scenario, but this is only going to work by long engagement and done by the right people. And sometimes you will have to agree to disagree. My fear is that the closer we get to an election next time and people are seeing their majorities under pressure, there may be some more tendency to bad behaviour, more populist behaviour, let's say. But at the moment, I think someone said you're in the sweet spot where it's a good time to do the difficult stuff because there's still time to get over that. But I do think it's the communication bit and the no surprises is going to be really critical. Even if something's not coming yet, if it's just coming over the hill, just keep teeing it up because then they know that they can think about their approach to it. You know, the North West and its spotlight, with the Deputy Prime Minister here and other Cabinet members, with Andy Burnham being a really key player, you've got this huge opportunity to leverage investment, but also it puts spotlight on the North West, which can be a joy as well as a challenge. But certainly, if you look to the last government, in places where they had Conservative Cabinet members, those areas did well because their MPs argued for resources. So you do have a really good opportunity to to argue for resources for your region. And for those of you who were in remember a previous Labour administration may have some reflections on that, whether things were different then or whether it was helpful. And you may have some reflections on the last Conservative administration, whether that was helpful. But certainly you've got a real opportunity, if you frame it right, that can give really good local benefits. MPs are ambassadors for your region. You know, they spend their whole time in Westminster talking. I remember being in a debate in Parliament about staffing in West Yorkshire NHS organisations, and there was a huge amount of goodwill, but also an opportunity for talking and getting the minister's ear for what needed to be different. So corralling MPs as ambassadors can be very helpful. And just finally, I put on, and I said this earlier, for most MPs, the NHS and care system is a bit of a mystery. It's so complicated. Most people who work within it find it complex. And they won't want to ask what an ICP is, the latest acronym. So whatever you can do to not patronise, but speak in a way that a regular person who doesn't know could understand, because they won't want to say, sorry, I don't know. It's a bit embarrassing to have to do that. So just helping give them really straightforward, accessible explanations of the system and how it's working and what's changing. So, for example, if the planning guidance is going to mean X, the planning guide, this is not very interesting to them, but what does it actually mean for the constituents? Can you talk it through in layman's terms, what it means in terms of services delivery? And certainly finding opportunities for helping MPs to walk in your shoes, bring them into your problems sooner rather than later. And asking them, thoughts on solutions is always very helpful. And if you can get a collective group of them, that's even more helpful. So those are just some considerations. Yeah.
How much power do MPs actually have?
They have no power.
Yeah, that's my, yeah.
They have none.
Yeah.
But what they do have is they have influence, and they have the opportunity to have conversations with people. They can talk to ministers, formally, informally. They can talk to local politicians. They have the power to convene, knock heads together, bring you together. And that sometimes can be useful. It can sometimes be less useful. But they have no power.
Yeah.
Some will leverage influence really well. Others will do it less well. And if you're new to this game, as lots of them are, they're probably in the doing it less well phase, perhaps. So possibly maybe suggesting how you could allow an MP to help convene something if there's a difficult conversation to be had about the future of a service, perhaps. Maybe they could play that role. That might be something to consider. That would make them feel central, important, but also brought in. Because as I say, they have no... I don't know if there are experiences in the room that you want to share and aren't scared to do so, about where you've managed to use an MP for a helpful convening role. Maybe not. But yeah, I would say leverage their influence and their ability to talk to ministers, but no power.
Presumably, many of them have, as well as good relationships, not good relationships with, for example, ministers and so forth, and leveraging them may be a disadvantage as much as an advantage.
Well, you've only got the MP you've got.
Yeah.
So you need to help them maximise their influence and their ability to do that. At the moment, I would just say the situation we're in is that you have a Labour government with a majority Labour MPs, and it should be an opportunity to have conversations with colleagues that get things done. I will give you a really, really weird random example from my other situation. The MP I'm working with has decided that children's playgrounds are really important. Having good playgrounds where children can play safely, they get off a screen, they develop relationships, all that stuff. In many areas, playgrounds have gone to pot. Now, you might think that an MP, what can they do? What's the interest? So we've realised that there's a lack of legislation that requires local authorities to consider play as part of their statutory duty. Really small. He's made the decision that he is going to get the law changed so that this has to be considered by local authorities. So now what is he doing? He's talking to ministers across 3 different departments, texting, talking in the lobbies. He's talking to the parliamentary private secretaries, so that's your MP backbenchers who supports the ministers in those departments. Talking to number 10 and the policy people. Talking to outside bodies, former children's commissioners, who are going to be an interesting lobbying force in. But, you know, this is what an MP can do, because something has sparked some interest. It might feel small, but if they are interested, particularly if it's a heart issue, as well as a headache, but heart, they are going to go for it and talk to people. So that's them using their power to convene, but also the conversations they can have. Okay. They're much more likely to be persistent and go with it if they care. They really care about something. And it's either because it's personal, a constituency issue, or because it's a particular professional interest. So that's just a really small example, but hopefully, and he would like to put on a leaflet at the next election, I have supported children's playgrounds. Well, I mean, that's not actually, you know what I mean? And it will have been something you could say that was a good thing to have done. Small, but doable. Any other thoughts or reflections on that, particularly your experiences that you've had of doing or not doing, taking these approaches that have worked or not worked so well?
Quiet, so I may as well.
Elkan, the floor is yours, sir.
Yeah, just on the influence that MPs can lead, it becomes a self-reinforcing process. And the example you give, this person becomes Mr. Playground. And if an issue arises, they'll think, oh, he's always going.
He never thought he was going to be Mr. Playground, but he is now Mr. Playground, and he's growing into the role. He doesn't have children, but he knows about Playground. Odd, isn't it? But you never know quite what will take the fancy of someone.
And you mentioned APPGs, and people saying there must be about 1,000 of them now, but it's very easy for an MP to set up an APPG.
Yeah.
And again, gain that reputation for being the expert in a particular field.
Yeah, so the all-party parliamentary groups, they set up at the beginning of every parliament. As I say, they are like MPs after-school clubs. You can have one on anything you want. There's one for every country, but there's also one for all sorts of things. There's an overarching health one that's very well attended. Then there's one for every condition, often set up by charities and organisations who want to have a way of leveraging their issues with parliamentarians. But in order to set one up, you have to have 20 parliamentarians sign up, so from the Lords and the Commons. But what that does do is it gives you the names of 20 people who have more of an interest in that thing, whether it's eye health or adoption, than other ones. So if you're looking for people who have more of an interest in an issue, they are the places to start. And yeah, as you say, it does give people an opportunity to learn more and then get inspired to do more on a particular issue. So, having sent you into silence, I would like to give you a chance now, and this is the musical chairs bit, to spend some time in groups to think about, she says moving on, some particular issues that you're dealing with locally or in your system, however you want to play it. And you're going to have an opportunity to have 2 half-an-hour conversations with our ex-MPs later, just to talk through some of the situation in which you're finding yourself. Whatever, there's no agenda, it's entirely up to you. They know that you will come with anything. It might be about the positioning, it might be the interrelation with local government, it might be anything, it's entirely up to you. But you'll just get 2 different perspectives on that. And as I say, every MP is different. I will tell you who they are and which group is which just beforehand, so you can Google them and see. They're not pretending to be anything, they're just here to kind of be a sounding board for you on some issues that are important to you. So I'm giving you the choice now to find system buddies or to stay put. We have 9 tables. What's the consensus? Are you sitting with people in your system that you're really happy with? Some of you aren't. Some of you want to find new friends. So we've definitely got a GM table at the back. I can see that. Who else have we got here? Who are we over here? We're Cheshire and Merseyside here. Are you? I've tried to give you a pairing that gives maybe slightly different perspectives, but those are your pairings. Didn't want to give them to you earlier in case Aviva West Coast let us down in any way. And Steve Brine, who's going to do a sort of quick session before lunch, should be here a little bit earlier, so I'm hoping we can have a little bit more time with him thinking about, you know, where ministers and the select committee are at the moment, which is good to capitalise on his time. But if you can make a note of the people you're going to be seeing, if you want to Google them, it'll give you a sense of who they are. Are you good with that? Has everyone got a note of that? So entirely over to you, how you want to use the next half an hour to decide how you want to use your time with them after lunch. Okay, very good to hopefully see your brain cogs whirring. And I hope you've got to a point where you've got some things to explore with our guests after lunch. Good, that is the right answer. Because we've managed to get Steve a little bit earlier than this afternoon, I just thought we should capitalise on his experiences, really, both as an MP, as a health minister, and also as chair of the Health Select Committee, Health and Social Care Select Committee. And we've kind of left this a bit of a free-flowing session, really. I think I've said thoughts and hopefully questions. I've told him you're a lot who loves answering questions, making points, putting your hands up. But it's really just, we've got half an hour before lunch, and just to get a bit of a sense from you, Steve, I will put your slide on behind you so we also know. From probably what it's looking like in the ministerial team at the moment. Oh, no, I haven't got you. I'm sorry. Did I have you? Oh, there you go. There you go. Right, so Steve, I'm going to hand it over to you entirely, and then I'll pop up again.
Do we have the lapel on?
There you go, you're good.
We have it on. Yes, we do. Exciting. Right, well, I am early, and considering I got the cross-country train from Hampshire, this is a significant achievement. Broken Britain is fixed. You'll be pleased to know. So that's me. Yeah, I was in the Commons for a long time. I always feel like I need to caveat that I left. I didn't lose. In last year, yeah, I won 4 in a row. I was the Man City of Winchester, and Spurs fan. So sorry, but I just had enough. Just wanted to do some other things, and now spend a lot of time. I chair a charity in Winchester, cancer charity. It's very close to my heart, called the Winchester Cancer Sanctuary, and work advising numerous clients across public, private sector, and do a bit of this actually, which I really enjoy. I also says it up there. Thank you very much. I do have a podcast, who doesn't? So me and Dr. Helen Stokes-Lampard, who some of you will know, used to chair the Royal College GPs, a good friend of mine, used to come into the office a lot when I was the minister. We just hit it off. And when I became chair of the Select Committee, I said, I've got this idea for a podcast. And Helen said, yes, let's do it. So we did, and it's all about, it's health and politics. Prevention is obviously our focus. Helen has just been made the CMO in New Zealand, so she has emigrated, nothing to do with me, but Dr. Sarah Wollaston, who is my predecessor's predecessor as chair of the Select Committee, just joined last week as the new co-host. And we had Sir Simon Wesley on, who some of you will know did a big review for Theresa May's government and for us in the ministerial team at the time into the Mental Health Bill Act of 1983. Did a big independent review into that, which has informed the Mental Health Bill that is currently before the House of Lords, going to the House of Commons. So if wherever you get your podcast, I believe is the expression. So look, I am acutely aware that I stand between you and lunch, which is never a great place to be. But there's probably there's three words that I would start with for you: change, review, change. Okay, it's 2 words. And I suppose the question is that, and the starting point that I would have in giving you a sit-rep, if you like, as to where we are at the moment in health and policy and where the ministers are, is that, you know, there's no question that change is needed. I would argue, and do argue very strongly, that the status quo is just simply not sustainable, that the system is not sustainable as it is. Demand outstrips supply, and in any metric I know, public or private, that is unsustainable. There's no question that change is needed. The question is whether the reviews, of which there are many, lead to the change either side of them. So I thought maybe the smart thing to do would just be to pick 3 of them and give you a sense as to where I think they are. So the 10-year plan, goodness. And I say goodness because I was involved in writing the long-term plan, which was the last time we had a decade plan, Theresa May's government. And they are fiendishly difficult because they're like peeling onions. The more that you peel, the more comes off, and then the more that you want to peel, and the more comes off. And that's really where they are at the moment. And, you know, they are based around, I suppose I should say this before I go into it, is that, you know, Wes Streeting, I know Wes well, and I rate him as a person, I rate him as a politician. As a Secretary of State, I don't know, is the truth of the matter. How do I know him? Well, when I was Public Health Minister, Terence Higgins Trust, National AIDS Trust came to me and said, we want you to set up the HIV Commission to see if we can get to 0 transmissions of HIV by 2030. And I said, yes, I wanted to do that. And when I left office, I became a commissioner of that. And Wes was the Labour voice, if you like, and I was the Conservative voice. That's how I know him. So I rate him as a person, and I rate him as a politician. You know, holding that seat was no mean feat. And he's fiercely ambitious within the Labour Party. You know, if there were to be an accident with a voice coach, imagine, then he would be one of the people in pole position to take over, no question about that. He's highly ambitious politically, and he's good. He's good at what he does. As a Secretary of State, I think so much for him rests on events and these reviews and whether he can actually carry them through in a way that few have managed, actually. So 10-year plan process, look, he has been smart in that he knew he was going to be Health Secretary. I mean, I find it quite surprising that a lot of ministers, everybody in Westminster in the lead up to the 24 election knew that Labour were going to win, seemingly apart from the Labour Party. But Wes is an exception to that, in that he had done quite a lot of pitch rolling in the work that he'd done. He travelled extensively, he'd been to Singapore, which is where we'd been as a select committee, maybe we'll come on to that later. And he'd looked at other systems, and he'd set out what the civil service need. In my experience, the idea of the civil service as yes, minister, and that they're there to block you and go, ooh, that's very brave. Actually, quite the opposite. Really what they want is a clear steer from you. And Wes gave him a very clear steer. He said, look, I've got 3 shifts that I want to implement across the system. And you know what they are: hospital to community, analog to digital, sickness to prevention. And I think that was smart on his behalf, actually, is that he gave them a clear steer. Now, nowhere in policy, in politics, in government, does the rubber hit the road harder than it does in health. They are very, very easy to say. You know, I don't think there will be a health minister that hasn't, and I did many times, there won't be health ministers that have not said they want to move from sickness to prevention and they want to prevent more ill health. But the challenge is, you know, when only 9% of the NHS budget is spent on primary care, is he really prepared to shift resources upstream to primary prevention to reduce that demand that I talked about at the very start? Because that's where the rubber hits the road. You know, and as a minister, I don't think I ever visited an acute trust. Tell me over lunch if I'm wrong, but I don't think I ever visited one who said, Minister, what we desperately need is less money. So he's either got to find more, which is going to be difficult. You see the figures today. The headroom the Chancellor maybe expected has gone. She's facing a return to austerity, or she's facing more tax rises. Very, very difficult in the second half of Parliament for any Chancellor to do, let alone a Labour Chancellor. So he's either going to have to find new money to do it for the so-called double running, which is going to be needed in the sickness prevention shift, or he's going to have to literally move money. Now, I represent Winchester and Hampshire. Hampshire Hospitals Foundation Trust runs 3 hospitals, Basingstoke, Winchester, Andover. And the first 2 are acute trusts, and they both have obstetric-led maternity units. They both have ED. They're not going to have, in the future, there's a reconfiguration coming. Now they're in a really difficult spot because the new hospital programme that was going to build a new hospital between Winchester and Basingstoke, I mean, I know it's been kicked into the long grass of 2029, 30, but I can tell you now, in Whitehall speak, they don't write budgets and put it in a box marked 29, 30. The NHP is in serious trouble, as we predicted on the Select Committee when we did a joint piece of work with the Public Accounts Committee around the new hospitals programme, which was in many ways a fantasy of Boris Johnson's mind. He has many. But it was not properly planned and it was not properly funded, nor did it properly come from the NHS as being what they said they needed. So, therefore, he has got a major problem on his hands in trying to deliver those 3 shifts. In some ways, and I don't laugh because I know that many of your staff members will say that turning on the PC is still the challenge. In some ways, analog to digital is going to be the easier of the 3 because there's quite a lot of trajectory on that. There's big money and big private sector engagement that wants to put money into that side of one of the 3 shifts. Sickness prevention, for the reasons I've said, is going to be really difficult. So, yes, the government have picked up the last government's tobacco and vapes bill, which obviously I very much supported. It's the biggest preventable killer in our country today. It was the right thing to do. God knows how my old party, that's just how I describe it, has got itself into a position of voting against that at second reading, but it has. Big mistake. And yes, so the government have picked that up, and that's a good preventative measure. Very slow burn, though, right, on raising the age of consent, and the vaping bill that will go alongside it, the impact that will have on disposable vapes. But, the real shift to prevention, we were doing a big prevention inquiry on the Select Committee. We were sort of about a third of the way through it before dissolution happened. We started with vaccination, second biggest impact you can make on public health other than clean water, of course. And, we have a vaccination strategy. Has it done well this year with the flu vaccine that's presenting in your acute trusts? No. So, there's an awful lot more that you would want to see from government in terms of shifting to those prevention strategies, but that being done through what they describe as the health mission. So you can't see the 10-year plan in isolation, you have to see it as part of the health mission. The Prime Minister wants a mission-led government, completely understandable, completely right, makes a lot of sense intellectually. He said all the right things in opposition about it. But, as we found when we were doing the prevention inquiry, look, 90% of the things to do with prevention of ill health are not the responsibility of the NHS. When it comes to clean air, increasing evidence from the CMO around clean air and lung cancer, that is the responsibility of DEFRA as a government department. The houses that we live and the impact that they have, the inequalities that they then exasperate and then they present in the acute sector, respiratory illness and worse, they are not the responsibility of the Department of Health. So that's why the mission-led government is right. And, the health mission, chaired by, predominantly actually it's chaired by Wes, needs to be chaired by the Prime Minister. I can tell you now that in Whitehall, it doesn't happen as the Prime Minister stands right behind it. I wanted to extend the HPV vaccine to boys. The Secretary of State wanted to do it. We had, the officials, the stakeholders, the charities all lined up behind me wanting to do this. But it really wasn't until I got the Prime Minister to agree that I actually got that across the line. And I'm really proud of it because I think it will save a lot of lives and it will eradicate cervical cancer, which will be not a bad thing. So, I suppose the challenge there is the Prime Minister needs to chair it, and he needs to drive it across Whitehall through his missions. And that then is going to create massive challenges for you, because it is going to require a shift in resources, as well as a shift in emphasis from hospital to community. 9% of NHS budget spent on primary care. Then, if you take the sickness to prevention side of things, I suppose there is so much more that I would love to see them do and to take on the so-called nanny state argument. Now, I pursued and brought in the SIDL, the sugar drinks industry levy, the so-called sugar tax, that George Osborne had announced in a budget several years before. And somebody stood outside DH for 6 days with a placard that said Nanny Brine. on it, right? And I said to them, and I've said this many times before, is that I believe in a publicly funded health service, you have a right and indeed a responsibility to intervene in public health. Because when you don't, it rebounds on the state. I believe that if you were actually trying to make a small c conservative argument for a smaller state, then you'd be landing that in a good place, because a big health estate is actually a sign that you're failing on health. A big prison estate is actually a sign that you are failing on the criminal justice system. So and I tried to make this case to Liz Truss that she was completely wrong about prevention, but this fell on deaf ears, not for the first time with me and her. But anyway, so I digress down that rabbit warren. The point that I'm trying to make is that you have a responsibility and you have a right to intervene in public health. And you think that it's hard for the right in politics. And for the reasons around the tobacco and vape bill that we saw, it is hard for the right. It's also very hard for the left. And don't underestimate that. When the original smoking legislation in public places came in, the Labour Party had a devil's own job. I think a number of cabinet ministers on a free vote voted against it. There were lots of arguments around working men's clubs and the impact that it would have. It would send them all out of business. It would send the hospitality sector out of business. It was the right thing to do, and credit to Tony Blair for pushing it through, but they had a really difficult job on the left. The left and the right often meet round the back. And actually on public health and intervention, they often find themselves strangely in a similar place. Look at the voting record on the tobacco vapes bill second reading since the election, and you'll see some strange bedfellows who are in the same place on intervention. So it requires a government with a big mandate and a big majority. Hey, we have one. It requires a government with those things to push that through and to be brave and to say this is the right thing to do for the long term. And if Wes does that, then I'll rate him as a person, a politician, and a Secretary of State. So that's the 10-year plan. The other thing on that is to talk about is the spending review. So they say that the 10-year plan will come out in the spring. I'm sorry to break it to you, but for those of you who've ever been involved in Whitehall, the spring does not mean March and April in Whitehall. It's an expression that's used to mean June or July. So when we brought in the smoke-free white paper that I wrote as to how we were going to get England smoke-free by 2030, I was asked at a dispatch box once, when will it come out? Because the officials were dragging their feet on me on it. And I said, it'll be out by summer recess, to which some wag on the other side shouted, which summer recess? And I said, this one. The officials in the box were in panic because I'd committed us to do something which they hadn't agreed to do, and Number 10 hadn't agreed. It doesn't make you massively popular in government, but you know what? I got it out before that summer recess. And that is... that's where we are with the 10-year plan in terms of its timetable. I just can't see how it comes out before the second part of the spending review. And bearing in mind the spending review is now likely to be June, and it could slip to July before summer recess, then I don't see it coming out before they've been in office for getting on for a year. And that's a challenge for them. And I'll come on to at the end why I say that's a challenge for them. In terms of money, I mean, like, Julian Kelly, isn't it, who is the Chief Financial Officer at NHS England, was before my old select committee last week, and he said that pretty much all of the 10.6 billion that was given to the NHS revenue in the budget has already gone on health inflation and pay deals. Who knew? And in many ways, they're repeating what Blair says is one of his greatest mistakes in his first term, was putting huge money without reform into the NHS. So that's probably in the negative ledger for Wes as to where I see him stacking up at the moment as a Secretary of State. And there are some increasingly pessimistic voices. You know, I often listen to Matthew Taylor's podcast, Health on the Line, which is excellent, from the Confed. And I was listening to them the other day talking about the 10-year plan. And actually, you know, Matthew's a former Labour man, but, you know, quite negative tone, actually, about what they're feeling about the 10-year plan and where that's going to land at the moment. And, you know, I know that for many people, even at your level, let alone the people who work in your trusts, you know, what ministers write in a 10-year plan is just so far saving over the heads of the day job, which I'll come on to in conclusion. So, you know, I suppose there are three ways, finally, on the 10-year plan that I view it. One is that ministers have no idea what reform they want, and they're buying themselves time. Option number two, they have every idea what reform they want, and they're buying themselves cover with the biggest consultation exercise in the history of the NHS, quote, end quote. Three is that it is a genuine, warm, fluffy, cuddly consultation exercise that will lead to the writing of the 10-year plan. Now, in my experience, it's probably not number 3. It's probably a combination of number 1 and number 2. And where it lands will define the success of this organisation and the government politically over the next however many years they have in office. Second review, social care. So I was just reading in, I get sent this healthcare management, and I think it's really good actually. Some really interesting articles in there. There is a pretty scathing article from Martin Green, who many of you will know is the Chief Executive of Care England, about the care reforms. Or I say reforms. There were problems with Deal Not from the very start, and George Osborne has said on his podcast with Ed Balls that Deal Not didn't roll the pitch on his social care reforms with Treasury. He landed it without an interim report, actually, and it scared the life out of Treasury officials. Certainly the price tag did. And so he was always arguing from the outside, actually. Now what they've said is, in the emergency statement at the end of July, they kicked down the line again, the cap, which had finally been legislated from the oven-ready deal on social care that Boris Johnson talked about when he was elected in 2019. So they kicked that away, and then they brought in Baroness Louise Casey. Now, she's a busy Baroness, because the Baroness is also chairing the review into gangs that came out of the big argument around public inquiries at the moment. So she's very busy at that. Look, you are better placed than me to judge whether you think that what social care and the join-up needs is another review. All I would say is I think it is slightly unfair to describe it as complete long grass. And I say that because the review's going to be split over 2 phases. The reason they say there's another review is they want time to build a cross-party consensus. I actually don't buy that because they have a big parliamentary majority. And it comes back to what I said at the start about courage and about doing it. And I think people know what needs to be done. But it's not quite long grass because there's a first phase that will report next year in 26, which will identify the issues and set out recommendations for the medium term. If only we didn't know the issues. And then the second part, 2028, will set out for the longer term and around the National Care Service. Now, the National Care Service is something that was mentioned in Labour's successful manifesto. I don't know what that means. I don't think it means what Andy Burnham meant when he was Shadow Health Secretary, shadowing Jeremy when I was with him in the early years at the department, which is basically an NHS of care. I don't think they mean that, although I'm not sure they know what they mean by it. And therefore, they're going to try and work that out throughout the period of the KC review. What I know is, and one of my jobs is I do a little bit of work with companies that advise people wanting to invest in the care space, because obviously it's majoritively in the private sector. For investors, it's a frightener. It's a real frightener. And that means that people are holding back investment. And that's before we get to the national insurance, the NICS increase, and what care providers are saying about that. What I do know is that by 28, we will be in the foothills of a general election campaign. General election has to be by August 29, legally. Now, you tell me whether you think there is a Prime Minister learning the lessons of history who is going to launch a social care policy in the foothills, let alone during a general election campaign. My father-in-law used to say to me, if you can't be a good example, be a horrid warning. And in some ways, Theresa May's experience in the 2017 general election campaign, of which I was a candidate, and I watched the doorsteps go like from that to that big time, literally overnight, as she launched a care policy in a general election campaign. So I think you've got to judge for yourself whether Wes has built Louise up here. This is what he said in the press release when he appointed her. We're appointing one of our country's leading public service reformers and Whitehall's greatest doer to finally grasp the nettle on social care. No pressure, Louise, given everything else she's got to do as well. So that's a big build-up. That's review number 2. Review number 3, which in many ways I don't think anybody's really noticed. You will have noticed, but certainly the public I doubt will have noticed yet, is what I call Dash 2.0. So Penny Dash, a name that you will all know, that I predict you will hear a lot more of. No spoiler alert, but you will hear a lot more of in coming months. Dash 2.0 is doing a review into the whole patient safety landscape. And she was reviewing the CQC, the National Guardian's Office, Healthwatch England, HSIB, Patient Safety Commissioner, so Henrietta Hughes' work, and NHS Resolution. So she's doing all that alongside all of this. And, I suspect that will very much focus on effectiveness, value for money, patient experience. Some of you will have seen Julian Hartley, some of you will know Julian, who was at providers, NHS providers, and now just taken over as the new chief executive at CQC. A good man, Julian. Quiet, but seriously effective. Gave a very interesting interview to Sean Linton, I think, at the Times on the weekend, talking about CQC, and he's been there now for 3 or so months. And I suspect you will see the CQC change a lot. I suspect you'll see it reborn, possibly renamed and rebranded, with a focus on, yes, patient safety, which obviously is a key part of its remit, but particularly around value for money, productivity, patient experience. That I may be wrong in that prediction, but that's what I think will happen. And they're 3 reviews. They're the 3 reviews. That whether they sit in the middle of change either side, I don't know, for some of the reasons that I've outlined to you. And as ever, and I promised we'd come back to this, they're all basically, they're all eclipsed by the day job. And that's the problem. That's where health ministers will be finding themselves right now. In the early days, they'll be getting all those briefings as to what these different organisations do, and it's very exciting. But the truth is that being a health minister is like being in the ring with Mike Tyson. You are constantly punched in the face by events. You do your best to make sure some of those punches don't show. Some of them seep out to the dispatch box. But you are dealing with the day job. And so we should remember that, like all before them, this government are at the mercy of the day job and the pressures on the system. Because, there's 3 reasons. If you talk to Jonathan Ashworth, who runs Labour Together now, he was the shadow Work and Pension Secretary, and he's a good friend of mine, Jonathan. He was a good man. He lost his seat in Leicester to, I think, an anti-Gaza war party. And he now runs a think tank called Labour Together. And they've done a big piece of work as to why Labour won. Number 1, it's to get rid of the Tories. Well, check, done it on first day. Number 2 is cost of living. That's why they're so desperate for growth. But beware the Biden, because you can have a growing economy and actually an improving economy, but people don't feel it. A cost of living, trouble ahead. And 3 is the NHS. So, for them, the road to re-election runs right the way through the middle of the NHS. And all those 3 reviews and the issues that I've talked around them, long-term, houses where we live, air quality, they're all very worthy and they're all absolutely critically important. But, I just listed a few things here, right? GP access now, NHS dentistry now, the immediate future of pharmacy first, which is one of my babies that I'm very proud of and I don't want to see go south. Elective diagnostic weights, will they really enforce the NHS constitution to give people the choice of providers? And then, of course, the winter pressures that the system is facing now and will face right the way through into the real spring. So, all of those things that we talk about, those 3 reviews, those big pictures, none of those really deal with the nows of the 6 things that I just listed. And so, I suppose that's the challenge for health ministers and where they are right now, is wanting to look long term, wanting to lift your gaze. And the real challenge of being a minister, and George Osborne said to me when I became a health minister that the best piece of advice he could give me is work every day like it's your last, because it might be, and he knows, and take decisions that you won't see the fruits of. Like the sugar tax, we're seeing some early signs on it. HPV, I mentioned, pharmacy first. You won't see the benefits of, and that's the challenge for health ministers, is to lift that gaze and to be there. And we can talk maybe in questions about the Health Select Committee and what role that plays in this, because that is, I think that I would say that as a former chair of it, of course, but I think that is important in the policy landscape. And just sort of Springer's final thought, if you like, from me, and then I'll take some questions from you, is that watch the devolution picture, because I think that's going to be quite interesting over the next few years. Devolution in England over the next few years. When I was on the way up here today on the train, I remembered that I'd signed off the health devolution deal to Greater Manchester. The other areas didn't get it. It was pre-Andy Burnham, actually. It was sort of as that was being born as a devolved body. And you will know better than me whether you feel that decision has been successful or showing any signs of being successful. But it'd be interesting to see if you look at the devolution paper that the Secretary of State, actually, Deputy Prime Minister, is making a statement on in the House of Commons today after PMQs. So it'd be interesting to see whether elections happen or don't happen. And it'd be interesting to see where they do move to these new combined authorities and mayoral authorities, and they're going to have a mayor in Hampshire, which is not as easy to do as it is in Greater Manchester in some ways. Be interesting to see where health lands in that, where the devolution of health lands in that, and therefore what then the future is of NHS England, which there's lots of murmurings around that at the moment. Government very wisely said they wouldn't embark on a reorganisation of the NHS, but politicians like to meddle. And devolution is one of my Springer's final thoughts to watch. So I'll leave it there, and then you can ask what you like. Okay?
Thank you.
Thank you, Steve. We've got like 4 whole minutes. And with all the questions I know you're going to have, we're going to condense that beautifully. So thank you, Steve. A lot there to think about. Reflections, questions, quiet screams. The question, how frightening is health for politicians?
And I know we've got short time. As John Burko used to say to me, short answers, short questions, please. I know it's not frightening. It's a wonderful opportunity. It's frustrating because, of course, unlike some departments, vast majority of the system that you are responsible for, I was primary care minister. How many GP surgeries are there? I couldn't possibly, could I? So it's quite frustrating in the sense that you don't have anything like control that you would like to have, and it's a very it's a very devolved system. I've often said, and I have said it publicly, so I'll repeat it here. There is no such thing as the NHS. It's a construct with a very good brand, and there are some national standards that we'll see over the next few days as to where they land. But generally speaking, it's a system of 1,000 providers. And so it's frustrating from that point of view as a health minister. But no, it's not frightening. It was the only job I wanted. And Theresa May said to me, what do you want to stay in the Whip's office? Do you want to go to a department? I said, I want to go to health, be the cancer minister and the public health minister, please. She said, that's very specific. Most people say, I'll do anything for a car and a folder. But that was all I wanted to do.
Thank you for the short answer.
Yeah.
Thank
Not
you.
sure.
Sakta, you wanted to come in.
I don't know about the length of the answer to this, but I just want to say thank you for championing prevention and also for the candidates here. Sort of left, certainly me, and I suspect many of us in the room, feeling we've heard the 10%'s gone, but 10 billion's gone. We've heard your reviews of the reviews, just working out what should be of a local public narrative and how that might land with our local politicians, or indeed with MPs.
Yeah, I mean, it's a really good question, and ultimately, it's delivery, isn't it? It's delivery. That's what your local politicians want to hear. I mean, we'll come on to it when my former colleagues join me after lunch, but just remember, as Catherine said to you earlier, I know, is that a lot of these MPs that have been elected, they won't necessarily be MPs after the next election. There'll be churn again. Either people will stop, people will lose, events will happen to them. And they may punch people in the street. You never know. So, they want to. I don't know who I'm thinking of. They want to move the dial quickly, and you want to move the dial quickly, don't you? You're a DPH, aren't you? I know. So just well briefed. So that it's delivery. That's what they want, and they love cutting ribbons. Love it.
So the answers came there, none, but plenty of food for thought. Another question. Thanks.
What do you need to do to really get on the health agenda the Treasury to take a much longer term view as opposed to the short termism?
What a brilliant question. Treasury hate spend to save. They hate it. They don't believe in it. The Treasury mandarins don't get it. It requires a political operator as a health secretary who has the ear of Downing Street. I think you have one here. I really do. So, that's why I hold back on my judgment as to how he is as Secretary of State, because it will depend as to whether he can convince them to do that. It seemed obvious through HPV, right? But they didn't want to do it. I basically had to really, really fight to get it through. And, he wants to do much bigger things than that. So, you've got to convince them on spend to save.
Steve, on that, does NHS England need a political operator as its chief executive, as in the Simon Stevens days?
God.
Sorry, we are really going to go to lunch, but I'm just saying...
Oh, I think it's lunchtime.
Is it? I'm just wondering whether, because certainly we know in the past David Nicholson banged a drum very heavily, as did Simon behind the scenes, alongside a Secretary of State. So is that important?
The diplomatic answer that you can take the minister out of Westminster is that Amanda is clearly not Simon. Simon was a former Labour health spad in Downing Street. He was highly political. He owned everything. Whenever there was good news to announce, I'd be told that Simon was doing it the next day, and whether it was bad news to announce, it would land on my desk as a brief for the UQ that was going to be granted the next morning. So, that's Simon. They've replaced poor old Richard Meddings, who was chair of NHS England, who was given the heave-ho pretty early on in this government. Not entirely sure what Richard did wrong, but anyway, he was certainly across the detail. But anyway, he's been replaced. So I think that they will put a chairman in. I may have mentioned their name earlier. I think they'll put a chairman in that will be quite political and will be used in that purpose by Amanda.
That's a very helpful answer, thank you. And without further ado, I'd like to say thank you, Steve. That's great. Steve is staying with us. And
we said, didn't we, if you didn't want to
if you wanted to have a chat, a quiet chat over lunch, he's here. Please nobble him. Don't punch him in the face. But do please go and have lunch, talk to your colleagues, and we'll be back starting again in an hour at 1:45. Thank you. Okay, welcome back, everyone. You feel like you're in the odd place at the front. This is the musical chairs game continues. So thank you everyone, and delighted to see that you're all still here for the highlight of our day. I think we might have some radio mics behind on. So it feels like we're in a rehab centre. It's a programme, and my colleagues are really delighted that you've come to help them with getting over being a parliamentarian. But in the process, they hope they can also be helpful to you. So really delighted to have an eclectic mix of former parliamentarians, some more recent, some less so. But what we're going to do for the next half an hour is I'd just like to get them to introduce themselves, and then what I briefed them to say, and it's really bad when you've got 9 people, because I'll go down a line and the 9th person will have nothing left to say, but maybe Holly, you'll be creative. Just to say just a reflection on the landscape we're in, and being a new MP, the sorts of things they remember were helpful, were not helpful, what they're hearing from colleagues, just a reflection on where we are at the moment with the group of MPs. They're all very aware, some of them a bit more painfully so, that the North West is quite a red place now to be. So there has been a big change in the political landscape, but others of you came in as a blue wave previously, so the cycle changes its colour. So I'm going to start in the middle, and I'm going to start with you, Tim, because you and I have worked together for a long time. So I think given that we've got the room we've got, and we've got some microphones behind, if you wouldn't mind standing up, just introduce yourself first. No comments yet, just tell us who you are.
Thank you very much. So I'm Tim Lawton. I am the now recovering former MP for East Worthing and Shoreham. I was MP there for 27 years, which is why these things are therapy for some of us getting over that. So I think I'm the longest surviving MP, but I decided to retire back in July of last year before I gave the choice to my constituents instead.
And what did you do?
What I did, right.
Us,
I was For half my 27 years, I was on the Conservative front bench, and I was the Children's Minister in the coalition government. I was also the Shadow Minister for mental health and quite a lot of health things before that. After being a minister, I was the Deputy Chairman of the Home Affairs Select Committee for 10 years. I was Chairman of the All-Party Group on Children on first 1,001 days from conception to age 2 was a big thing around best start in life and perinatal mental health, and I chaired a perinatal mental health charity for 6 years, amongst other things as well.
Thank you. Let's go to Paul next.
Thank you. It's nice to be reminded, Tim, that my name's Paul Williams. I was the MP for Stockton South for a brief period of time from 2017 to 2019. And I'm wearing a red tie to just give a bit of a clue. It's British red, not American red, I stress. But it's nice to be reminded, Tim, that despite being different parties, we had much of politics is about collaboration, and we worked together. I chaired a Health Select Committee inquiry into the first 1,001 days of life, and also worked with you on some issues to do with perinatal mental health as well. And sometimes we can be most powerful when we work across party lines. So I was on the Health Select Committee, and my background was in health. I was a GP and a chief executive of a GP federation before I went into Parliament, and I now lead community services. I'm a clinical director of community services for an acute trust in the northeast of England.
Thank you, Paul. Where should we go? Let Charlotte take the mic.
Hey, well, I'm Charlotte Atkins. I was MP for Staffordshire Moorlands, which is the north part of Staffordshire, from 1997 to 2010. I gave up politics for about a year or so, then a by-election happened, so I got straight back in again. And now I'm leader of the opposition, Labour opposition at Staffordshire County Council, and I'm the Labour Cabinet Member for Services in Staffordshire Moorlands District Council. So I keep my hand in.
Thank you. Let's come over to John here.
My name's John Stevenson. I'm the Member of Parliament for Carlisle. I was elected in 2010, and unlike Tim, I got removed by my local electorate. And it's really funny, actually, after the election, more people talk to me now that I've lost than actually when I was the MP as well. There you go. I was also a dreadful MP in the sense that I did continue to have a second job, in that I continued my legal career, which has actually been quite beneficial. When you do lose, you do at least have something to go and do. In Parliament, member of many various select committees, but probably the thing I got most interested in was I chaired the Northern Research Group of Conservative MPs, where I was very passionate about the North and what we could do to improve the North. And I continue to believe that that is a key part of government policy, regardless of who is in power.
Thank you, John. And just worth saying that amongst colleagues here, some specialised in health, others didn't. And so hopefully in the conversations you'll have today, you'll have a mix of people for whom their backgrounds are different. Leah, your term has come.
Good afternoon. My name is Leah Nietzsche. I was the MP for Great Grimsby in the last parliamentary period. I'm very lucky as a new entrant MP to have experience in a range of roles over the last 4.5 years. I was Parliamentary Private Secretary to Department for Culture, Media and Sport when Matt was a minister. I was also PPS for Boris Johnson when he was Prime Minister. I've also been a minister in the Levelling Up Department. Unfortunately, we don't seem to have a great deal of levelling up at the moment, but hopefully you do here in the Northwest. And also a whip. So if you want any juicy gossip, then I'm open to negotiation. Thank you.
My goodness, as Boris Johnson's PPS and a whip, I bet you've got some good stories. Right, so whoever's talking to Leah, you know. Thank you. Matt, would you
Hello, so I'm Matt Warman. I was the Member of Parliament for Boston and Skegness, where I lost to Richard Tice, for which I can only apologise, under Reform. And I was also a whip in the Theresa May government, and then for 3 years or so, a digital minister covering broadband, 4G, 5G, AI, digital identity, various bits and pieces. And after that, I was on the Public Accounts Committee, which is the committee that sort of grills civil servants rather than ministers and is differently productive.
And Matt, we got to know each other because you're...
Oh, yeah, sorry, the other bit is my wife is also a GP, so I get the other side of the NHS. Maybe that's a reason to try and stay in Parliament. But yes, she was also one of the National Medical Director's Clinical Fellows, so a bit of experience at NHS England and the Academy of Medical Royal Colleges and that sort of thing.
Thank you. We'll go to John and then Holly. There is another one behind you, John. Hopefully it'll work. Yeah.
Hi everyone, I'm John Leach. I was the Liberal Democrat Member of Parliament between 2005 and 2015, and I was part of the very large cull of Liberal Democrats post-coalition. I have the dubious pleasure of being the only living former Liberal Democrat MP who didn't vote to go into coalition with the Tories. I'm currently the leader of the opposition on Manchester City Council, and in my so-called spare time, I'm also working part-time for our new MP for Cheadle, Tom Morrison. So I wear several different hats. When I was in Parliament, I concentrated on two things. I was on the Transport Select Committee for 7 years, and I was on the Culture, Media and Sport Committee for 3 years.
Thank you. And John and I have been comparing notes about running an MP's office over the summer with no support, no IT, and what a joy it was. Yes, Holly, over to you.
So I'm Holly Lynch, and I was the Member of Parliament for Halifax, first elected in 2015, and took the decision, very heavily pregnant with young family, to stand down at the most recent general election. But most of my time on the front bench was spent in the Shadow Home Affairs team. I'd been the Shadow Minister for Immigration, Shadow Minister for National Security, and then I think having spent time being the Shadow Minister for National Security, they asked me to be the Deputy Chief Whip of the Labour Party to then try and keep our MPs in check. So similarly, quite a bit of Whip's office experience on the panel, but that's certainly how I spent most of my time.
Thank you very much indeed. So some really interesting and diverse experience in the room I hope you can make use of later. Right, so it's over to the tips. You're allowed one. Tim, can you restrain yourself to one? No. Have a microphone, although I know it's...
And it's really unfair.
Just talk, it's fine, it'll work. Tim, just talk, it's fine.
So the difference this time, I got elected in 1997, where we were down to 164 Conservative MPs and a load of new Labour MPs, including Charlotte. This time, it's a similar experience, although for our party, even worse. But you've got over half of MPs are new MPs. And so even, and I think a lot of them are feeling, certainly on the Labour side, of which most of them are this area, a bit vulnerable because of the way politics is going. So more than ever, I think MPs will be far more interested in their patch, their constituency, and what impact health services, schools or whatever are happening on their own constituents, which is not to say that they're not normally, but you tend to get a lot of new thrusting MPs who are desperate to get to ministerial positions and the top. More than ever, I think they will be open to conversations about how the hospital, the GP services or whatever in their constituencies are going, and to have some frank conversations. And if they know what they're doing, they should want to take those calls, have those meetings and see you face to face. So now is the best time I think there ever has been to make those approaches to MPs in peacetime, as I call it, rather than when something's going wrong or when you're in the news for all the wrong reasons or there's been some scandal. Make those relationships with your MP now, because it will be mutually beneficial.
Thank you. Paul, I'll go to you next.
Thank you. Thank you for having me early as well. I wrote down 5 points
Right,
just
well.
in case I got called last, so that I could tick them off as others
Go for
said
the
them.
really obscure one. It's like pointless, that programme, isn't it?
So I think I'm going to make one observation and then one recommendation then. So my observation, I think, is that most MPs are just normal people. They are very, very normal people. And their experiences of the NHS will probably influence how they feel about the NHS, and it will be their own personal experiences and their family's experiences of the NHS that that's the lens that they will see the NHS through most of the time. So don't necessarily expect them to understand the jargon, don't necessarily expect them to know very much about the way that the health service is organised, and a lot of politics about the NHS is conducted through the lens of anecdote rather than through a huge amount of knowledge and data. So that's an observation. My recommendation is completely different though. My recommendation is about how to form a relationship. And I think if you're approaching your Member of Parliament, you need to understand a bit about where they're coming from. There's a lot of publicly available information, there's social media, things they might have said in Parliament. It's definitely worth having a look in Hansard or Googling to see what they've said in Parliament about the particular kind of issue that you want to approach them with. But I think the very, very best thing that you can do if you want to understand how to get the attention of an MP, because there's so much competition for an MP's time, is to make a relationship, talk to one of their team members. So I would approach their office manager or their parliamentary assistant and ask how to get their attention, how they like information to be presented to them, what they're interested in, and get some real tips from the people that are working with them closely every day.
Thank you. Leah, I'll come to you. If we run out of tips, we can go into anecdote as well, I think, is also acceptable in the rules.
If we run out of tips already, we're really...
Okay, your MP should be very interested in you, and if they're not, then I think you should be quite rightly, perhaps outrage is probably too strong a word, but you know, we all know that the National Health Service and health generally is the public's number one concern and issue. So you are important, and your MP needs to be listening to you. Obviously, that needs to be done in a positive way. What I would say is make things simple. You may need a new hospital, and you may need, £40 million. As you will all be aware, there won't be many £40 million swimming around at the moment in the current economy. So I think what I would say is keep it simple. If your trust or your organisation hasn't been in touch with your MP by now, then you really should be. And I know everybody's busy, but get everybody together. Get them there to wherever you are to highlight for an hour. Get a photo opportunity, because MPs always want a photo opportunity. But ask them to ask questions of ministers in the House. Perhaps give them a question, suggest things to them. Or it might be something very, very simple in legislation. I remember once working with the renewable sector when we were going into lockdown, and there was real concern about being able to constantly keep building the offshore wind farms. And it came down to one word in legislation that made the difference between the wind farms continuing to be developed or the companies potentially getting into financial difficulty. So sometimes it can come down to something as simple as that. So engage quickly if you haven't already, and make it simple and make suggestions, because I was 50 when I was first elected, so I've got a long career, and in education, which is complicated. NHS to me is like knitting with fog. You need to understand the NHS, and it's really difficult. So a new MP will really, unless they've worked in the NHS or similar, will have no idea what all of your acronyms mean, and so don't be afraid to explain to them and bring them along with you.
Thank you. Charlotte?
Life in Parliament can get extremely busy, and MPs often need information at very short notice. So be contactable. give your phone numbers, and if they have a question, answer it quickly. I know when I was working for a trade union, if a certain person rang up, they got priority treatment, you answered their question in 10 minutes. It might well be that an MP is going into a debate, and once they're in the chamber, they can't leave it. So if they're ringing you to clarify something, then it's really important that you answer. But the important thing is, too, that no MP wants to read bad news in the local paper or on the radio. So be honest. Tell them what the challenges are. If there's bad news coming or good news coming, tell them. But no one wants surprises. So make sure you are contactable and that you're honest, and that they can know that they can check things with you quickly. Otherwise, they'll have to do with whatever they've got. And if you can be that extra pair of hands that can really give them the answer, you will build a brilliant relationship.
Thank you. Do you want to pass it to John? We'll go to John. Yeah.
Catherine said that we're both working for MPs currently, new MPs. And my top tip is don't expect the new MPs to necessarily have everything under control, even now. You may have had a relationship with a previous MP over a long period of time. When new MPs came in, they quite regularly had no staff at all. So when I started doing some work for Tom Morrison, there was just me and the former agent of the new MP who were doing everything. So if you've tried to contact your new MP and you've not had any luck, please don't give up. It's really important that you don't give up, because it is really important that you have that relationship. And I would advise, if an email's gone astray, and I'm sure there are some emails gone astray in every new MP's inbox since July, I would suggest find the office number if they've got an office. Some MPs still don't have offices in their constituencies, but find a telephone number to contact the MP, speak to someone in the office, and arrange an appointment that way. Don't just assume that you've been ignored if an email hasn't been responded to, because I know from personal experience that some new MPs have really struggled to get on top of all their correspondence.
There's definitely something to be said for the American 100 days handover thing. I think that would have made, you could have got the chaos out the way in the 100 days rather than doing and tomorrow you're running, supporting local constituents. Steve, I'm going to come to you on this, because you've been sitting all quietly in the middle. Is there a microphone there behind?
I gave you a couple this morning about MPs loving ribbons. I would echo, actually, about the no surprises thing. You want to get into a situation. I like to think I was in a situation with my hospital trust and my public services, is that the agreement that I had with them is that I would never comment on something before I'd spoken to them. That doesn't mean that I was in their pocket and you must never be in their pocket, but that makes you then part of the team, and that there's the trust that's then built between you. And I would say that that's even more important in good news, because what would happen is special advisors would contact you, or officials would contact you from the Department of Health and say, we've got this really exciting announcement about your trust that's coming out. And I would then speak to my trust, and it turned out maybe it wasn't quite as exciting. And so I would make sure that we were aligned, because there's nothing that breaks trust or stops it building in the first place than not being aligned. And I used to visit a lot of hospitals and obviously settings as a health minister, and I always used to ask about their relationships with MPs, and it amazed me how many MPs would visit their local hospital for coffee with the chief executive, and then away they'd go again. I never did that. I used to always say to my office, when we go, you've got to build in 2 hours, because there'll be a meeting and then there'll be a clinical visit. And we used to pick a different specialty each time in the hospital that we would then go to. Bluntly, because MPs love a photo in a hospital, and also because then you get to meet the different leaders and staff members on wards in the different specialisms. I just thought that was brilliant and allowed me to have an understanding. A tiny little bit of clinical knowledge is a dangerous thing, but it always used to be a clinical visit and then coffee, or the other way around. That would be my advice.
Thank you. John, appreciating we're getting to the tricky end of the ideas.
Thank you. Interesting comment earlier about MPs being ordinary people. Somebody once made an observation to me about MPs that we're actually a bit of a mixed ability class. That is actually quite important, because actually you've got to try and make our job as easy as possible for us to make it easier for yourselves. And I would just give a few practical tips. First of all, as a new MP, I wish somebody just sat me down and told me the structure of the NHS, because it is, even now, I still don't fully understand what it is. That would have been really helpful. Second practical thing is, who do I contact? Who in the trust or the GP world do I contact and have conversations with? And thirdly, we are actually paid £250,000 a year to employ staff. There's absolutely no reason why an MP shouldn't respond to any inquiry, any letter that they receive, and any MP that says that they aren't doing that, I think is failing in their job. It's not that difficult. So therefore, to make life easier for the MP, the best thing you can do for their office is provide a point of contact. Somebody who that office goes to, even though that person will then pass on the inquiry to other departments, etc. But it gives the office a point of contact, and that is enormously helpful, because an awful lot of the work that goes on is not actually done by the MP, it's actually done by their staff, and that would be very helpful.
Oh, John, you've just pulled back the curtain on the workers. Thank you. Holly?
I think I've got the short straw.
Not quite.
But
Matt's got the shortest straw.
Sorry, Matt.
Yeah.
So I think, as others have said, unlike others who are seeking to influence MPs, actually, the MP will already know that you are incredibly important stakeholders, partners in the town, in the city. So you've already got that route in, really, to the MP. They know that you are significant and they will want to engage with you. Just because of how much is coming into the MP's office, how many things will be competing for their time, it's just being able to get that cut through to make sure that they've really understood what your needs are, what you want them to take away and what you want them to understand. My advice would be, and I appreciate that you're all incredibly busy people, but if either you or somebody in your team can keep an eye on the parliamentary business to see if there are upcoming debates on the things that matter to you, on health. So that might be a debate on a piece of legislation, general debates. It might be debate in Westminster Hall. There is a second debating chamber in Parliament called Westminster Hall. And if you can provide the right briefing at the right time for MPs, they will not only read it, they'll process it, understand it. They will then repeat it and speak that in the chamber. They'll most likely do a press release based on what they've said, and they'll quite often do clips for social media as well. When you see that there is a debate coming up, most MPs are really keen to be on the record, to be saying the right things, doing the right things, advocating for their constituents in terms of health outcomes. And they'll be asking themselves, have I got all the information that I need to be able to put a speech together on this issue? And they'll want to include constituency cases. They'll already have those pieces of casework. Quite often those pieces of casework where people might have had bad experiences or, there's room for improvement. But what they'll then be looking for is those facts, figures, how they can be advocates for you, what the statistics are, what those really important outcomes might be. And if you can provide that briefing at that right time, they'll be your best friend. They really will, as I say, process that information and then be incredibly important advocates for you in the way that they go about using it. I think would be my top tip.
Thank you very much, Holly. And Matt, finally.
Thank you so much. So I suppose I have one thing I would say that you should ask yourselves, which is, what do you actually want out of your Member of Parliament? Because MPs basically have no power. They have influence and they have the power to get people round the table. But as you will know, they can't tell the chief exec of an NHS trust what to do. They can make a fuss about it in the media. That might have some influence, but it has very little executive authority. So it might be that you want your Member of Parliament to highlight the fact that you exist and you do great work. So if you're an ambulance trust, invite them out for a shift, for instance. If you have got a problem with a department being closed, moved, whatever that you think shouldn't be happening, members of Parliament have got immense power to get people round a table, but no power to actually make them do anything. And using that is potentially a huge thing that you can turn them into your advocate, and you can get solutions as a result of them influencing ministers or simply having conversations within the NHS system. But I think that realisation that MPs are potentially influential but very rarely able to actually single-handedly do the thing you might want should shape the relationship.
Thank you. I hope that's been some useful thinking, and I'm really pleased that some of it backs up some of the things I said this morning, or else it makes me look a bit silly. Really appreciate that. We've now got an hour for you to have 2 half-an-hour conversations with the chosen 2 MPs that they don't know yet who they're talking to, so it's all a bit of we'll play it by ear. We're going to need to do some musical chairs, so if you get back to your groups, I will put the groups that everyone's going to spend time with up on the board, and then your first parliamentarian will come and join you. So let's put this up. Hello to those of you who are still chatting, herding cats. So what? If you want to stay there, Matt, you can. You've moved now, okay. The rebel. I was just going to come to my parliamentary colleagues just for, you can stay put. So just any thoughts or things in the conversations that you've come away that hasn't come up so far that you think would be helpful to throw out there. I've got some mics if you are. Any thoughts from colleagues? Anyone want to throw anything in? The question was, is there anything that you've heard in the course of your conversations that you think would be helpful to share more widely? Oh, okay, right. Hang on, there's a microphone coming, Charlotte, and then Tim will come to you.
I think what I'm hearing from this table and also previously is the lack of partnership between local government and the NHS. I mean, I sit now on my Health and Wellbeing Board, and I've never come across the most dysfunctional committee ever. It was like a spectator sport. And when I started asking questions as a district councillor, they looked at me as I was mad. But I'm hearing on the table here that you know, local government may make a decision which may impact on the NHS. But although the NHS, the ICB, might have to go to an overview and scrutiny committee, it doesn't happen the other way around. So local government officers and councillors don't actually go to the NHS to account for their decisions. So there appears to be a one-way street here, and we're supposed to be in partnership. And if my Health and Wellbeing Board is an example of partnership, I would hate to see what partnership, what it would look like with no partnership.
It feels you might be teeing up a future programme of some description on... Tim, you wanted to come in with... I know you can boom, but that helps.
Right. Other than the money issue, which came up, I'm sure, everywhere, I mean, just two points to remind people. We are actually all on the same side. So there is a mutual benefit from your part of the health service succeeding in my constituency. Because MPs like boasting about why their constituency has got the best hospital in the world or a fantastic new scheme dealing with mental health for kids or whatever it may be. So remember, all on the same side. But at the same time, remember, as I've said to my 2 tables, all of you here really only have one boss. We have 75,000 bosses who are our electors. So however brilliant a scheme, clinically something may be, however great that innovation is, I and you working together have got to sell it to 75,000 constituents and the wider patients beyond. And constituents tend to have a great affinity with bricks and mortar. So if it involves knocking down a much-loved, ancient but crumbling hospital or other health facility, it's going to be that much more difficult to persuade people that it's in their best interest to do that. So bearing in mind that we have a much bigger constituency of people to convince than just it being a good idea clinically, then we're on the same page and get the MP involved right at the outset, rather than, as Charlotte said, the worst thing we like to hear is to get a phone call from a journalist saying, Mr. Lawton, what do you think about the closure of the paediatrics department at your local hospital? And we know nothing about it, whereas we could be part of helping to sell that and getting people on board if it is actually a good idea.
Thank you, Tim. Any other colleagues want to... yeah, John, have you got the mic there?
I was just going to say something about PR and making the NHS, people in the NHS having the opportunity to sell yourself as well as you possibly can. I represented Manchester Withington constituency and had the Christie Hospital in my constituency, which was incredibly effective at promoting its great services and the fact that it was a great hospital. I think sometimes some NHS services are not so good about promoting what they're good at. We had a discussion on one of the tables about one hospital being the specialist stroke hospital for the area, but no one really knowing that it was the specialist stroke hospital. And I don't think you should be concerned about making the best case for yourselves, because our constituents want our local hospital to be great. They want to feel confident that if they go to get treatment there, they're going to get well again. So don't be embarrassed about making the best case for yourselves, and also sometimes I use the word spin doctor in a positive rather than a negative way, because if you're a spin doctor, it means you're doing your job well. So just make sure that you are giving your best possible the best possible image of yourself, and making sure that you can, when you have to reconfigure service, never use the word reconfigure, by the way, it's a terrible word to use. But when you have to reconfigure services, talk about the positives rather than allowing other people to talk about the negatives of what's actually going to happen.
Thank you. Any other colleagues want to say anything? Don't feel obliged necessarily. Holly, yeah. Here we go. Okay.
One of the things I mentioned that, particularly when you've got newly elected Labour MPs, and I'd hope this was the case for all MPs, is actually that relationship with the trade unions that represent lots of your staff is really, really important, and that's another route into engaging MPs. And whilst not everything is about the election and being re-elected, I just use the example of having done a lot of work advocating for police officers in my time as an MP. Actually, because of the nature of policing, when it came to a general election, I had very, very little that I could say publicly. I couldn't put images of police officers on my leaflets. The police could never say anything nice about me because that's absolutely not allowed. Having done work with paramedics, ambulance trusts were the same. They couldn't say anything. But actually that relationship with GMB and their members, and the way that trade unions could then say, actually, yeah, this person's done lots of good work on behalf of our members, was quite powerful. So just consider perhaps as well that relationship with trade unions and the relationship between the trade union and staff with MPs is something that they will take really seriously, and just another sort of avenue into that engagement that's worth considering.
Thank you. That's really helpful. I know you're a thoughtful bunch, and I'm just going to throw it out to you as a collective. And we will do, once we let our parliamentarians head off, we'll do a bit of debriefing. But I'm just interested, from anything that has sprung, that you think it would be useful to reflect off them from your conversations. Yeah, Dan.
All MPs look at an ambulance.
Right. And you were worried about how to engage your enormous patch. Now it's just chuck them out. Yeah. Actually, in my patch, the air ambulance got in touch. Now, the idea of going out on a helicopter, really loved that. Yeah. So, yeah. Right. So that's your takeaway from today. Everyone on an ambulance.
Do it in the summer.
Right. Yeah. Anything else? Any others? Yeah.
Yeah, I think it's the power of relationships, isn't it? Everything we've talked about today is predicated upon...
Yeah. No, sorry.
Everything's predicated upon building relationships. That's it.
Oh, that's it. Yeah, absolutely. Yeah. Relationships. And also, I think, and I was working with some nurses yesterday and talking to them about how you have to put it in your diary to spend time actively doing it. It just doesn't happen with the day job being so busy. How do you prioritise the relationship building stuff? Question. Other thoughts? Anyone else want to throw something? Oh, David, go on, and then I'll come to Leah.
I have to express a personal interest in you.
Right, hang on. Let me give you that.
I'm a non-executive Is it working?
Yeah.
Non-executive director at Thameside and Glossop ICT, but the personal interest is I also sit on the Academy's board. Having been to events like this a number of times, I'd want to thank our recovering parliamentarians for their efforts today. I think it's been really informative and probably one of the best sessions I've been to with the Academy. And it's just a pity we didn't do this when you weren't recovering parliamentarians, that you were actually
you can do this for real in the real world.
Yeah, and I think they've given us enough ammunition to be able to do that better than we did before we came here. So it was really a thanks to them, and hope their recovery goes well in the future.
That's very kind, David. Thank you. Leah.
I think on the couple of tables that I worked with, quite often it was, we've got this problem, how do we solve it? What can our Member of Parliament do to solve it? Quite often the Member of Parliament alone can't solve it, but I would say it's not just about legislation, it's not just about new policies or new ideas. Quite often you will have the stakeholders in your area who can help solve that problem. So if it's transport, you need to engage with your transport companies. If it's education, engage with your education companies, because it may not be as large as having to go to Treasury to ask for millions of pounds. It may be that actually the relationship between yourselves and your universities and colleges isn't working as smoothly as perhaps you could. And if you say to your colleges, we need to train 100 new nurses in the next 3 years, there is no college that's sane that will say, no, we're not going to work with you to recruit another 100 trainee nurses. So I think that's the biggest power your MP can have, is convene your stakeholders to be able to come up with those problems, because you've all got pressure points, and quite often if you all get in a room together you can actually ease a lot of your pressure points within the existing structures we've already got in the country.
Thank you, Leah. I've probably got time for one final point. If you're sitting there burning with a point you'd like to make, I don't want you to go home feeling sad. In that case, I'm going to thank our 9 recovering parliamentarians very much. And I'm going to ask them to exit into the Manchester sunshine. Incredibly grateful that you're all still here. Can I just say, this is very impressive. I just wondered if you wanted to go back with your system people so you can have the benefit of 6 conversations, debriefing. I just think it's important for you to have a bit of time to debrief and perhaps think about, from what you've heard, for your system or your organisation, what are the things you think would be most helpful for you to do? Like to give you kind of 15 minutes to, at least start having that conversation here before you all disappear off back to the day job. And then we'll just pull out a few things that would be helpful for us to hear at the end of the day. But yeah, have a conversation about what's next for your system, given what you've talked about and heard. Here is your moment. Right.
No, go on. I think you should pause.
I think you'll be great. Girl power.
What did we talk about? Okay, so from our table, we had a few takeaways.
And your system is?
We're in Lancs, South Cumbria. So I think it's more engagement with our MPs, obviously. Bringing them to see our services, and then thinking more about that broader stakeholder engagement, particularly around the voluntary sector, and other key stakeholders, political influencers and so on. And trying to do that is quite tricky. So we've got Lancs and South Cumbria FT on our table, and that's quite tricky because they're providing services across so many constituencies that actually that's in, it's 18, did you say, MPs? So it's quite a mammoth task, isn't it? So, yeah, bite-sized chunks. Yeah.
Chipping away. I love that as a strategy. Thank you.
So I'm going to call our local MP when we need help with ambulance handovers. But no, I'm really grateful. It's a brilliant experience, and we've learnt a lot, haven't we?
So what are you taking away specifically for your patch?
We've got a few tricky problems that I think we've perhaps not engaged our local MP on enough.
Okay. Okay.
And maybe the MPs are pretty ordinary people.
MPs are ordinary people. This is true. They are. Let me come over here.
We're ready. Poised and ready.
So Cheshire and Merseyside Part 2?
Well, we rebelled, yeah. So we're
right,
Cheshire,
you're
Mersey
a
and
mix.
GM.
You're a
Yeah,
blend.
we stayed on our original table because actually a lot of the challenges that we're experiencing are held in common, really. So I think for us, or for me, certainly the key takeaway was that, you know, as others have said, the power of building relationships is really key. And it's about finding the common ground and the shared motivations. We're all doing the jobs we're doing because we want to make a difference. What we need to understand is, you know, how do we bring that to bear for that mutual gain, for the benefits of our population? So, you know, in a time of conflict, when there's lots of differences of opinion, find the common ground, build your relationships. So that's my takeaway.
Lovely, thank you.
Downstairs to the honours, are you down?
Oh, ambulance man.
Dan the ambulance man.
Dan
thank
the
you,
ambulance
to be
man.
specific, you know.
So it's a new children's TV show coming, isn't it?
Yeah, so I was fully coached / volunteered as per the day. So I think one of the things that we were talking about taking away is, and this wasn't probably a predisposed cynicism necessarily, but I think what's resonated through all the conversations is actually what really matters in terms of the NHS to MPs isn't the party politics of the NHS, it isn't the 10-year strategies. Actually what it's about is that real world care that's being provided by people to people. And I think actually I've taken away that really clearly did matter far more. Now, we didn't discuss this one, I'm going rogue for a second, but I think on a bit of a slightly more challenging point, the reality is that probably for everybody in this room, being really simplistic, we're going to have to do less with more, or more with less, sorry. We wish it was the other way around. I've not read the planning guidance properly, have I? But actually, what came across a lot was what clearly matters to MPs is things that people can touch, see and feel. So bigger buildings, more people, which is in direct contradiction to some of the challenge we face. So to me, there's a real positive and then something to reflect on of how we take away.
Can you stick it on a leaflet? That test needs.
I'm fine. I just put them in.
Is there a picture? Well, that test has been sorted. Thank you. Yeah, that's lovely. Thank you. Would you mind passing that over to the table behind?
Merseyside table. And I just want to say thank you, actually. It's been a really interesting, reflective day. We came up with two things. One of them was one of Holly's points, which was actually thinking about developing talking points proactively for our MPs. So actually developing that relationship based on giving them the information that will help them to take part and to be well informed. And secondly, which is similar, but it was about the relationships issue, was you described it as where's the common ground. We described it as what's the hook? Where is that person working, or where are their interests that align with things that you want to that you need their support with, so that you are developing an understanding of which of the MPs in your footprint, because often we're working with multiple MPs, are going to be the ones who will come out to bat for you on a particular issue, and developing that relationship and that understanding. And we found it really interesting, I think, just having that opportunity to talk to people on an individual basis, and to realise that everybody's human.
And different. Yeah. Thank you very much. Can we go to GM? Unaccustomed as I am.
I know, so yeah, a perfect handover there. So we're at Greater Manchester table. The MPs who joined us were fabulous. We had really good conversations. I think the the one thing to take away from it is the kind of early engagement, ongoing, consistent, intentional engagement. So I think we reflected that we've got a tendency to engage with MPs about a specific issue that's coming up, whereas actually it needs to be that underpinning relationship that's consistently done.
Thanks, Paul. And over to you.
Cheers, yeah. So we're the Cheshire part of Cheshire Merseyside, and I think the point's just made. Given I'm last, we'll say we agree with all the above. But I think the other thing to say was around the power to convene that MPs have. It was described as when we make the call, no one ignores it, which I think is probably something that we certainly thought was really powerful. And certainly when we think about some particular Cheshire issues, it's how we bring together that kind of cross-party group of MPs as well and use their collective influence to convene the folk that we as the NHS in our little bit of the world wouldn't have the influence to be able to do so.
Thank you. And another example of the power to convene I think is helpful. Our local hospital has a new build. It's nearly ready to go. The access road into the hospital requires street lighting. SSE Electrical Company were delaying on putting the lighting in. Therefore, the new build was not going to be able to open in March. So I basically spent a whole week on the phone on and off to SSE's head of something or other, who answered my call because I'm phoning from the MP's office. And it was just not, the builders were stopped because this couldn't progress. But as the MP's office could use that power to push and push and push to get them to do what they needed to do so the hospital build could open, because that is what our constituents need. It was costing everyone money. So that was a really good use by the hospital estates team coming and saying, right, we need you to play your MP joker card at this point to get things moving. And that did help. So I would say that was a really good, productive example of working together. I'd just like to say a huge thank you. You've really all thrown yourselves in today and been really out there with the questions. I know how comedians who've done their first night at a club where everyone sits like that, or a working men's club night out. But thank you. No, I'm really pleased to hear that this has stimulated you to think about what you do back at the base, and appreciating you're working in really, really difficult times. And I personally wish you all the very best with that. Pass over to Frances just to, a couple of things before we finish.
So I've got a great job of just saying thank you, and I realise also that I've worked in university for many years. My students used to say, best evaluation you'll ever get is if you let us go early. So I remember that, so I've got my own club. But I just want to say a huge thank you. First of all, thank you to yourselves. Like I said, there's a lot still here, which is wonderful, but also to say thank you for coming along today. We know that it was a topic that was requested, but you never know till the day, actually, if people are going to turn up. And like we all said, it's been fantastic. I'd like to say a big thank you to the Leadership Academy, to my colleagues on this table here and lots of other different tables. And thank you so much for organising this. As I'm sure you all realise, there's been a lot of organisation and planning in that. So if you just mind, just a little quick round. A quick thank you to Ross and Alex for videoing and having very soft shoes, as you allow us to see, just like moved along very quietly. So thank you very much. But the biggest thank you, of course, goes to Catherine for today. Thank you for running today. It has truly been inspiring. It's truly been inspiring. I think the biggest test goes, for those of you who know this, often you find the truth when you have a chat in the women's toilets. And at the biggest chat with about 3 or 4 of us in there, so much so people were coming in and joining in the conversation. And they were saying how fantastic it was, how you were running this brilliantly. It's good, but you weren't in the toilets too, you're a bit embarrassed. But everyone was saying how great it was. The MPs, who I can't thank them because obviously they're not here, but in particular having them here, and also Steve, if you could pass our thanks on, because he was, again, really, really engaging and inspiring. So yeah, that was a true thank you that you got, and so thank you, Catherine, thank you so much. I'd just like to say what we'd really appreciate, the slides are going to be sent round. What we could also ask is evaluation. we'd really appreciate if you could, I know it's always a bit of a pain because I want to go for trains, but also what would be great, because we're here, a part of our role, our main thing is that we support yourselves. And as being part of the Northwest Leadership Academy, that we put on events that you really want and they'll make an impact and have a difference. So for us, hearing this feedback and hearing how much people have enjoyed it is genuinely really, really motivating and encouraging for us. And we want to put more events on like this. So please let us know. This is one of a series, so what other things would you like? Again, please let us know what those are. And then I think that is it. I think that's all the things I've got to say. I've got all my little list here. So just really a final round of applause for Catherine.
And I would just to say, I'm really happy if you want to have private conversations about situations you're facing and you think it would be helpful to bat them around a bit, find me on LinkedIn. Increasingly less on Twitter because it's all a bit crap there now. But I'd be really, really happy to have a chat, or I can find you someone more helpful to have a chat with if that would be useful for what you're going through. So thanks everybody.
The thing I didn't say, with a look from Charlie then, I didn't announce that we've got our Festival of Leadership, which again is a similar sort of event. We've got the date, Thursday 6th of November. I realise that's many, many months away, but I'm sure it'll come around. So please secure your place. And again, look forward to seeing everybody there. Thank you.
Thank you. Thank you very much.